Hi, I'm Dr. Avantika Tripathi, oral and maxillofacial surgeon, course mentor Dentium. Today we will discuss about the help kit of Dentium Superline implant. Being an implantologist, we all face challenges in our implant practice in the form of fractured screws, abutments or fixture. Dentium has taken care of those challenges by providing a supportive hand in the form of a help kit. This is the Dentium Superline Help Kit. Let's discuss the component of this kit in detail. These are the screw remover which are used to remove the fractured screw inside the fixture. This is the screw tap repair which is used to repair the internal surface of the fixture. This is the fixture remover. It is used to remove the fractured fixture from the patient's mouth. These are the abutment hex remover. They are used to remove the broken hex of the abutment from the fixture. This is the cover screw or abutment screw remover. If the cover screw or abutment screw is unable to remove with the help of hex driver, then we can use this driver to remove the cover screw or abutment screw. And this is the ratchet. Let's demonstrate the use of fixture remover in this dummy model. So first of all, I will remove the fixture remover from the kit and I am going to place it over my fixture and I am going to fix it in the anti-clockwise direction. Then I am going to put my ratchet that I have taken from the surgical kit and I am going to put it over the fixture remover and I am going to give a anti-clockwise direction. We will see that the fixture is coming out from the bone. If it is a nicely osseointegrated fixture, then it is very difficult to remove it with the help of the fixture remover. Then we have to use the Trifine kit for completely removing the fixture from the bone. A partially osseointegrated or a failed implant can be easily removed with the help of a fixture remover. So we can see that the fixture is completely removed from the bone. Now we have to remove the fixture from this driver also. For that I need the ratchet which is there in the kit. So I will engage my fixture in the ratchet of help kit and I am going to put my another ratchet from the surgical kit. So the direction of the ratchet will be in the forward direction and the other ratchet from the help kit is only used to hold the fixture. So I will give a forward direction and I will see that my fixture remover can easily be loosened up from the failed fixture. So I will discard the failed fixture. Now I will demonstrate the cover or abutment screw remover. So I have already placed a cover screw in this dummy model and I have distorted the internal surface of the cover screw just to adapt and just to give a proper demonstration of this cover screw remover. So we are going to place this cover screw remover over the cover screw and we are going to give a anti-clockwise direction with the help of the torque ratchet. As you can see, there is an arrow which is denoting that we have to go in the anti-clockwise direction. So we are going to engage the cover screw remover over the broken cover screw and we are going to put the ratchet over it and we are going to run the ratchet in the anti-clockwise direction firmly. Then when we will rotate, we will see that the cover screw is moving. So first in the anti-clockwise direction, the cover screw remover is going to engage inside the cover screw and then gently it is going to come out from the fixture. So we will keep on rotating till the cover screw is out of the fixture. So now we can see that it is partially out. If you feel that you can engage the hex driver and you can pull the rest of the cover screw out, then you can do that. If that is not possible, then you can keep on engaging the same driver and keep on giving the same movement and pulling the cover screw out of the fixture. So by this we can remove the broken cover screw, distorted cover screw from the fixture with the help of the cover screw remover. If the screw head of the abutment is distorted and we are unable to engage our hex driver and unscrew it, then we can use the same cover or abutment screw remover and we can engage it similarly in the abutment screw, and we can put our ratchet over there and we can run the ratchet in the anti-clockwise direction to remove the distorted screw from the abutment. So by giving anti-clockwise direction, we can simply remove the screw from the abutment. So this is all about the cover screw or abutment screw remover. This is the screw remover. It is used to remove the broken screw from the fixture. It is available in two lengths. It is handpiece driven and it is used at a speed of 30 to 50 rpm in the counterclockwise direction. It is very useful in removing the broken screw, as well as it also protects the internal thread of the fixture from being damaged. Next component is the screw tap repair. It is mainly used to recreate the 11-degree internal taper of the fixture. We just have to put the screw tap inside the fixture and assemble the tap tool with the ratchet. We just have to start tapping using the tap tool with appropriate torque. If we feel that the driver is overloaded, then we'll just stop tapping and remove the particles using the suction. We just have to repeat the process 3 to 4 times until the repair is complete. Next component is the abutment hex remover. It is used to remove the remaining hex when the hex portion of an abutment is broken. Insert the abutment hex remover into the remaining hex hole of the fixture. Assemble the ratchet over the abutment hex remover and rotate it into the clockwise direction to lock the abutment hex remover tip and the remaining hex. Now disengage the ratchet and remove the remaining hex by rolling or twisting the abutment hex remover carefully. Do not apply overload over the abutment hex remover while removing the abutment hex. Using Help Kit prevents trauma to the surrounding bone and saves chair time. It is designed for simplicity and, most importantly, implant success. That's all about the Dentium Superline Help Kit. If you like the content of this video, please like, share and subscribe to the channel. Thank you.